Good afternoon. It's July 27th, 2023, and it's Dr. Wolf here in the morgue. You can see here, it's a little messy, but there's no bodies or anything out here. And today I am going to just show you a random tool that we use in the morgue that is present in most morgues, but also present in most kitchens. All right, so this is a drawer with some random tools in it, and as you can see here, there is a ladle, a soup ladle. Why would this be present in morgue tools? The answer to that question is very commonly during autopsy, we have to measure the amount of fluid in body cavities, in particular the pleural cavities, or the cavities where the lungs are, and the abdominal cavity, also known as the peritoneal cavity. Now, of course, virtually every morgue will have a suction hose that can remove fluids, but not everyone, in fact most, don't have the ability to suction those fluids out into something volumetric where you can measure it. Usually those fluids are just sucked out into the sink and then down the drain. So by using this ladle, we're actually able to scoop it out and put it into something volumetric like a pitcher and actually measure the exact amount. I'm also not a big fan of the suction hose because when you suction out at high pressure, you have the potential to create aerosols, which if it is an infectious case, something like tuberculosis with a pleural effusion, you might just be aspirating that out into the air. And obviously that is a danger for everyone who is present. So let me give you an example of why measuring that sort of thing is important. Let's say you have a case with a gunshot wound to the chest and the bullet passes through the pulmonary artery or the aortic arch, and then there's a lot of blood in the pleural cavity. We try to measure that as accurately as we can because when that case goes to court, that is a piece of evidence that lawyers will ask about in terms of, based on the amount found in the chest, how long do you think this person survived? Knowing how long a person might have survived after taking an injury like that is important circumstantially in the case to basically tie details together for, did a person run 2 blocks after they got shot? Another is, did they suffer? A lot of times people just want to know, did that person suffer, and if so, for how long? So yeah, one of the most surprising things I experienced when I became a forensic pathologist was to see just how many kitchen tools are actually used in the morgue.